Do you feel as though you've lost your zest for life and all sexual desire after 50? Well, tune in for an important conversation of why you're not alone and what you can do about it. Thanks for tuning back in for another segment with Dr. James Simon. Thank you so much for staying with us.
My pleasure.
Our last segment, we gave us some great information on what a lot of women go through: vaginal dryness, vaginal atrophy, and how that really it can destroy your sex life. I mean, if it hurts, who wants to have sex?
So let's start where we left off with pain. I like to say, when was the last time you put your hand on a hot stove on purpose? When you were 3 or 4, you did it by accident. That was enough to train you to know you don't do it. Well, the same thing happens. If you have pain every time you have intercourse, you're not going to want to do it. Your brain is going to turn off. You're going to shy away. And so that's very important. And frequently, husbands and partners don't know. Women frequently just take it. They don't bring it up. They don't tell their doctors. They don't even tell their intimate partners because they don't want their intimate partners to shy away or to think in some way they're abnormal. And it's very important. Partners I found to be extremely understanding and even helpful, believe it or not, if they know what's going on, because they are engaged in the intimate act with their partners for reasons, and they want them to be pleasurable for the partner too. So it's really important to have open communication.
Then how do we rediscover sensuality once we hit that plateau?
So there are a couple things that are important that are generalizable, and I think most women and their partners don't know. First is, we've already talked about it, get pain out of the equation. If there's no pain, there are still causes for decreased desire for sex. Women as they age, also men as they age, lose testosterone. Their testosterones go down dramatically. I'll give you an example. Men and women lose about half of their testosterone. Yes, women have testosterone, but by the time they get to age 50, compared to what they had when they were age 20. And testosterone is one of those hormones of desire, what we would call spontaneous passion, spontaneous desire, and it's half as big as it was just by being age 50 as being age 20. The duration of one's relationship also is important. That a romance is extremely important to women and also to men. And if you're in this kind of sexual ritual that doesn't have any surprises, as most couples are apt to settle into with long relationships, then there are no surprises. There's no romance. And so those romantic things that you used to do together can sometimes help, and there's no drugs involved. You maybe alcohol and good food and a night out, or the movies or a play or whatever used to do it in the past. The answer is you need to bring those things back. So aging, some romance, but then there are a group of women who, in spite of all that, in spite of having a loving partner who they really adore, they just have no desire. And women who are not interested, and not interested all the time, cannot be caused to be engaged in sex, or who allow themselves to be engaged in sexual intimacy and don't get any pleasure at all, ever, there's a problem. And there are a lot of those women, by the way.
Is testosterone a possible solution for both, we're talking women specifically now, to rejuvenate the desire?
So testosterone does have a positive effect on desire in women who are near menopause but are premenopausal, and women who are postmenopausal. Okay? The problem is that there are no FDA-approved testosterone preparations for women. 0. There are about 30 for men, 0 for women.
Well, now let me ask you something, because I get testosterone pellets that I know it's not FDA. It's a bioidentical. Do you have opinions on the pellet therapy for women? I mean, it's done it definitely got my sex drive back up.
So my feeling about off-label or non-FDA approved testosterone treatments for women is that as long as the blood levels of testosterone remain within the normal female range, I have no problems. The problem is if a little is good, then more is likely to be thought to be better. And a lot of times, and I don't mean a few times, a lot of times I see women who have testosterone levels in the same range as normal men. And while that really is great for a short period of time, really strong sexual interest, sense of empowerment, lots of lean muscle, and intense orgasms. The problem is after time, women who are getting too much testosterone start to look like me. They get a beard, and they lose the hair on their head,
Wow.
and some of them get acne, okay, like they did when they were a teenager, and these are not good for a woman's look. So I like to think that my look is okay for a man, but it wouldn't look too good on a woman.
Well, no, I have not had any facial hair yet. Other than that's funny.
So
Yeah.
the answer is you must be getting a reasonable or normal female amount of testosterone.
Yeah. Well, then again, to kind of sum up our segment on rediscovering sensuality, rediscovering your sex drive, what is your best advice?
So in addition to using testosterone, we now have a non-hormonal treatment that's FDA approved for low desire. And it's very important that we speak about that. It's called flibanserin, and its brand name is Addy, Addyi, and it's FDA approved for younger women, premenopausal women, but there's lots of good scientific information for women after menopause that shows that it works to rejuvenate their sexual desire. Spontaneous sexual thoughts, spontaneous sexual fantasies, and desire to engage in sex. These are all improved to a highly significant degree with this medication. And that data is published and in the public domain. So it's one of the non-hormonal approaches to improving a woman's desire.
Okay. Well, there are so many other things so many more questions I have, so many other things I want to talk to you about. I hope that you'll agree to come back on Second Act TV. This was our first introduction. I've thoroughly enjoyed it. I know that there's great information that our viewers are going to be thankful for.
There are millions of women that need to hear the things we talked about today. Millions of them.
I agree. So I hope you'll agree to come back and join us on another episode soon.
Well, thank you very much. It's been my pleasure.
Thanks so much for watching. Right here's another video I think you might enjoy. And while you're at it, please subscribe to our channel. Buttons right here. Thanks. See you next time.